Coronary artery disease. Cardiovascular disease remains the leading cause of death in the United States in men and women of every major ethnic group. In fact, in 2008, over 400,000 individuals died in the United States from coronary artery disease. Coronary artery disease is the most common type of heart disease. This is my concept map. It goes over what we're going to. Coronary artery disease is a disease in which a waxy substance called plaque builds up inside the coronary arteries. Coronary arteries are the arteries that supply oxygen-rich blood to the heart muscle itself. A major cause for CAD is due to a buildup of atherosclerotic plaque. It's a chronic process that begins in adolescence, as early as your 20s, and progresses as you age. It begins to actually cause problems and cause symptoms for men after the age of 45 and women after the age of 55. Atherosclerotic plaque causes structural and compositional change to the inner wall of the arteries, and therefore impeding the blood flow to the blood vessels that surround and serve the heart muscle itself. This is due to the artery lining being injured, and then the plaque gets deposited in that area to repair the injury. The plaque thickens and uses cholesterol and protein and muscle cells to repair itself, and as it thickens, the artery actually hardens and narrows, making them less elastic, and that also hinders the amount of blood flow to the heart muscle. This plaque can also break off, and when it breaks off, it can cause a clot to form, and if the clot becomes too large, it can also block blood flow to the heart muscle. According to the National Heart, Lung, and Blood Institute, another name for coronary artery disease is atherosclerosis. Atherosclerosis can affect any artery in the body, including arteries in the heart, brain, arms, legs, pelvis, and kidneys. As a result, different diseases can develop based on which arteries are affected, and therefore patients with CAD most likely have plaque affecting other arteries of their bodies as well, not just necessarily their heart. One of the most dangerous and life-threatening effects of CAD is when it affects the neurological system. It can actually cause a cerebrovascular accident, or CVA, or a stroke. There are different types of strokes that can occur, and these strokes are a thrombotic stroke or embolic stroke. Thrombotic strokes occur when blood clot forms in the artery of the brain and therefore blocks blood flow. And an embolic stroke occurs when a clot from another part of the body breaks off and becomes lodged in a smaller artery, therefore blocking blood flow to that area. These conditions cause what we call an ischemic stroke, and that means that the blood flow to the brain is cut off. Therefore, oxygen isn't getting to that area, and it's going to die. Patients with CAD also usually have hypertension due to the constriction of the lumen, and this also narrows the arteries that supply the kidneys with blood. This damages them, causing renal insufficiencies and later on actually renal failure. Along with that, patients with CAD can also develop peripheral vascular disease, and this can affect the arteries that supply the legs and arms. Signs and symptoms of PVD include pain and cause the extremity that it's affecting to be tired, painful, and they can even develop a loss of sensation or numbness. If left untreated, PVD can also lead to gangrene and even possible amputation of the limb. Risk factors for coronary artery disease. There's non-modifiable ones, which you can't really do anything to change, and then the modifiable ones, which you can. Non-modifiable would be age and genetics. As you age, your risk for developing coronary artery disease increases due to the buildup of plaque that accumulates over time. The risk for women increases at the age of 55, and their risk also increases after they go through menopause. One thought to that is that it's due to a decrease in the estrogen levels that women have post-menopause, and this estrogen level is thought to have a beneficial effect on the artery itself, and when it lowers, it makes the artery more susceptible to the development of coronary artery disease. The risk for men increases at the age of 45. Genetic-wise, you're born with it. You can't do anything to change it. One example of this is according to the American Heart Association, there's a gene that makes African Americans more sensitive to the effects of salt, and this salt sensitivity makes them more susceptible to the hypertensive effects of their high salt diets. In fact, individuals who have this gene could actually even raise their blood pressure by as much as 5 millimeters of mercury with just as little as 1 extra gram of salt. The modifiable risk factors are going to be the risk factors that you can control to some extent. These risk factors accelerate an inflammatory vascular process that leads to the buildup of the plaque in the coronary arteries. So if you don't smoke, control your blood sugars, your blood pressure, your cholesterol, you're active and you maintain a healthy weight, then you could reduce the chance of this inflammatory process occurring and therefore causing damage to the lumen of your artery. Intervention wise, we're going to look at primary, secondary, tertiary. Primary interventions, they aim to prevent the disease or injury before it even occurs. This can be done by preventing the exposures to the hazards that can cause the disease. And for coronary artery disease, we can do this by educating about the importance of a healthy diet, active lifestyle, maintaining a healthy weight, and not smoking. This is especially important because since CAD is a chronic process, it's important to emphasize these lifestyle changes early on so that they can develop healthy habits that they'll carry on later on into life. And they'll also be preventing the early development of the coronary artery disease that normally starts in your early 20s. Secondary interventions are those that aim to reduce the impact of the disease or injury that's already occurred. This is done by detecting and treating the disease as soon as possible to halt or slow the progress. A way to do this for coronary artery disease would be to do regular exams and screening tests to detect the disease in its early stages by regular blood pressure checks, glucose checks, and checking your cholesterol. A lot of times these are done at your annual health screening or your annual physical. Another thing that can be done is once you identify that these individuals are starting to develop coronary artery disease, you can start them on a daily low-dose aspirin and encourage, again, the diet and exercise programs to prevent further development of the disease. Tertiary interventions are going to be those interventions that the person already has the disease, so these interventions are going to aim to soften the impact of the ongoing illness and its lasting effects. This can be done by helping them manage the long-term problems caused by coronary artery disease. This is where your procedures are going to come into place, your stents, your open heart surgeries. There's also cardiac rehab programs and support groups that people can be a part of to help them with their disease.
Treatment plan. My treatment plan is going to look at primary, secondary, and tertiary interventions, and then how it applies with technology. Education is extremely important, especially early on. You want to emphasize heart healthy eating, so fat-free, low-fat dairy products, fish, fruit, beans, vegetables, eating your whole grains. Avoiding a lot of red meat, coconut oils, palm oils, really sugary foods and beverages. You want to maintain a healthy weight. This can greatly lower your risk for coronary artery disease. And usually you want to speak with your doctor or healthcare provider to see what an appropriate weight goal is. And then sometimes lifestyle changes aren't enough, so you have to move to the secondary interventions. And you might need to be started on medications like certain statins to lower your blood cholesterol. And the National Heart, Blood, and Lung Institute actually found that just by lowering your cholesterol level alone, you can decrease your chance of having a heart attack or stroke. If we can't do primary, can't do secondary, the disease has already progressed, you need to go to tertiary. And tertiary treatments would be medical procedures and surgery. Those are going to be your PCI and cabbages. They're going to be used to actually treat the blocked artery. In this procedure, they open up the blocked or narrow artery. They use a thin, flexible tube with a balloon, and they thread it through the blood vessel, and they open it up by placing a stent. After your medical procedures, a good thing to get your patients involved in would be cardiac rehab. Cardiac rehab is a medically supervised program that can help improve the health and well-being of people who have cardiovascular issues. The rehab team is made up of doctors, nurses, exercise specialists, physical occupational therapists, dietitians, nutritionalists, and psychologists. The rehab usually is two parts. There's an education, counseling, and training area, and that's where you understand your heart condition and ways to reduce your risk for future problems. The team helps you learn how to cope with the stress of adjusting to the new lifestyle and how to deal with any fears you might have about the future. And then there's the exercise training portion. This part helps you learn how to exercise safely and strengthen your muscles and improve your stamina. And your exercise plan is based on your personal abilities and needs and interests. I thought that a good technological tool for this treatment plan would be using phone apps that track your food and activities. Due to the fact that a huge part of preventing CAD revolves around all those modifiable risk factors like eating healthy and staying active. And I think that technology would be a great addition to this treatment plan because you could use your own phone apps to track what you're eating and doing throughout the day. And research shows that individuals who write down what they eat are more likely to be successful at losing the weight and keeping it off. Due to having to be honest about actually writing down what they eat, and a lot of people go to write it down and realize somebody else is going to read it or could see it, and they're like, I'm just going to skip that donut at lunch. So I thought that would be a really good addition to the treatment plan.
Wrapping this all up, as you begin to age, changes in your cardiovascular system caused by the buildup of this plaque over time can lead to the development of coronary artery disease. Certain risk factors, such as age, family history, smoking, diabetes, hypertension, hyperlipidemia, living a sedentary lifestyle, and being obese, can increase the likelihood of one developing coronary artery disease. Due to the risk factors that damaging the artery, and this damage causes the more buildup of the plaque. This plaque buildup is silent, and this silent buildup over time is why it's important for healthcare providers to be vigilant about screening for coronary artery disease, especially in women over the age of 55 and those who are postmenopausal, as well as men over the age of 45. And it's especially important to do these screenings and educating these patients who are members of the ethnic groups that are an increased risk for coronary artery disease.